Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the basics of disc bulges and disc herniations. So when you look at the normal intervertebral disc, and here's a cartoon, you have two layers, and the best analogy is that of a jelly donut. Okay, the outer layer is the harder one. It also has nerve endings, so you can feel pain if there's a tear, and that's the annulus fibrosus. The inside is more gelatinous. That's called the nucleus pulposus. There are no nerve endings in here. Okay, normal disc is 80% water, 20% collagens and protein. The disc is a great shock absorber. Every time we bend, twist, flex, extend in your spine, or run or jump, stresses are absorbed by having water get pushed out of the disc, and then it comes back in. When disc degeneration occurs, usually it's between the ages of 20s to 50s, and it can be due to a number of factors: obesity, smoking, repetitive trauma. There is a genetic component, and then there's social and environmental factors. One example would be, you've been a truck driver for 30 years. Those repetitive micro trauma can degenerate some disc space. And this leads to loss of fluid in your discs, loss of height in the discs, and then tiny tears or cracks. So here's a cartoon showing a healthy disc, and then you have a disc that's starting to degenerate, okay, and it's losing height and it's bulging, kind of like a tire that's getting flat. And then here it's so compressed that you really can't even see it, okay? So when you lose water, it's almost like what I mentioned, a tire losing air. You start to not only lose height, but it starts to bulge, okay? And that bulging is very common. 35% of those between the ages of 20 and 40 have degenerative disc disease and bulging discs. But interestingly enough, no back pain. So just because you see a disc bulge or bulges on an MRI does not mean that person's going to have pain. So with a disc herniation, if a tear occurs in the annulus, okay, this outer layer of the disc, it may or may not result in a disc herniation. Okay, so here you see the disc starting to bulge in one area. It's actually not torn. And even a bulge can pinch on what you see here, a nerve root. So it doesn't necessarily have to be a disc herniation. But if part of the disc herniates out, and that's called a slip disc in layman's terms, it has a higher chance of pushing on a nerve root. Okay, it can actually herniate out and pinch off, and that ends up being a sequestered disc herniation. All right, there's various names for a disc herniation: slip disc, herniated nucleus pulposus, prolapsed, herniated. They all mean the same thing. Symptoms of a disc bulge or herniation. You may have no symptoms at all. Okay, in fact, most disc bulges don't cause any pain. Bulge symptoms, if they occur, may include back pain. It can include sciatica pain if you have inflammation in the area. It can also have some spasms and some aching. Disc herniation symptoms, once again, you may have nothing, or you may have a burning, searing pain. It could be a sensation of pins and needles or frank numbness. It can also have some motor weakness, and then rarely incontinence can result. That becomes a surgical emergency. Well, what's the treatment? If the pain is not too bad, if you're not having the incontinence type of thing, then benign neglect. You can just watch it, see if it gets better. If it's bad enough, you may want some over-the-counter medications, Tylenol or anti-inflammatories. There's also prescription medications. Once in a blue moon, you can do a Medrol dose pack, which is a burst of prednisone over 5 days and then tapers off. You don't want to have that every week, because it does put a shock to your adrenal glands. Narcotics for short term, as well as non-narcotics like tramadol, can be very helpful. Muscle relaxers, neuropathic medications like Neurontin and Lyrica, and possibly some topical prescription pain creams or patches. Spinal decompression therapy is intermittent spinal traction that can be very helpful. Chiropractic, physical therapy treatment have also been shown to be helpful for relief. When you get to interventional treatments for a disc herniation, there are a few. One would be trigger point injections. These are superficial injections that can help a lot with reducing spasms and aching. This is an example of an epidural injection. Here you have the disc herniation. It's pinching on a nerve and sparking up inflammation and pain and sciatica. This steroid injection around the nerve root, not in it, but around it, can bathe this area with anti-inflammation pain reliever and relieve that pain. Okay, that's the gold standard. When you start looking at intradiscal injections, that's more for degenerative disc disease, and that is where you either inject steroid, or the pain doctor may inject some regenerative medicine material like stem cell therapy or platelet-rich plasma therapy. What are the outcomes? Over 75% of those with degenerative disc disease and symptoms are able to avoid the need for surgery. Okay? Out of those with sciatica symptoms, from a pinched nerve or irritation from an annular tear, over 95% are able to avoid the need for surgery. Okay? There was a large study in Journal of American Medical Association almost 10 years ago that showed the outcomes of disc herniations at 1 year are no different than discectomy. Okay, so avoiding surgery with pain management versus having surgery, the outcomes were no different at 1 year, but you avoid the risks of surgery. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are many clinics in the state participating, accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.